Live soon. So the question I'm going over is functional medicine right for me? Is the energy recovery system right for me? Could it help me with my fatigue? So I want a few questions that have come up. One of the questions is, can you help me? Can functional medicine help me if I have bad genes? So you have bad genes, right? So does anybody know what that means, having bad genes? Is typically people are talking about the MTHFR gene, which is probably the most common. But there's also a whole genetic pathway that we test in our office and on our online programs of, are your mitochondria working well? So there's a couple different genetic tests that we work with, but the MTHFR is the most common. And yes, functional medicine, we can help you. The online program, the energy recovery system, can help you if you have the bad genes. So what does that look like? Well, we work with those genes. A lot of times we'll add solutions in or nutrients in that will help you work with the genes you have. We can't change your genes. We can't change your genes like we can't change your hair or your eye color yet. Maybe in my lifetime there'll be a way to do that. I'm hopeful. But for now, we just have to either fill in the nutrients that you need to complete the genetic pathway to get the end result, or sometimes we have to give the end result to go into the next pathway. Hey Shelly, hey Clayton, if you guys have any questions, let me know. I'm just going on real quick to answer a couple questions I've had. Will functional medicine work for me if, and I'm inviting people to get on a live Q&A today at 3 p.m. inside the energy recovery group. You'd have to join the group. The other question we're getting, will functional medicine work for me if I'm already taking a thyroid medication for fatigue? Can you help me if I'm already taking a thyroid medication for my fatigue? So first of all, if you're already taking a thyroid medication and you're still fatigued, something else is wrong. Either they're on the wrong track, maybe it's not just the thyroid, and I did a couple Facebook Lives about that earlier this week. So it's you're either on the wrong dose, you're on the wrong medication. So if you're on a thyroid medication and you're still fatigued, absolutely functional medicine could help you. We dig deeper and find out what's underlying, what other organs aren't working properly. So that's a question. Hey Kara from San Francisco, great to have you joining. If y'all have any questions, please jump on. Another question I've gotten recently is, will functional medicine work for me? Can you help me with my fatigue if I'm on an antidepressant or an anti-anxiety medication? Yes to both. If you're on one of those, neither of those specifically are for fatigue. However, they are prescribed a lot for fatigue. A lot of Western medicine doctors, you go in and say you're tired, they'll give you an antidepressant. I haven't quite figured out why. Maybe they're equating fatigue with depression, or they think, well, if you're fatigued, it's got to be depression. And those are two very different symptoms. So if you're on an antidepressant and it didn't fix your fatigue, first of all, I'm not surprised. But second, it's not just a brain chemical imbalance. So yes, functional medicine can help dig into that a little deeper and figure that out. Let me see if we have anybody asking any questions here. Okay. So again, I'm inviting y'all to our live Q&A inside the Energy Recovery group. You'll have to join the group from this page. And I'll do answer any questions you have today at 3 p.m. Central. The last question that I've had is functional medicine right for me if I'm already taking a bunch of supplements? So if you're already taking a bunch of supplements and you're still fatigued, then you're either not absorbing those supplements, and we need to take a step back and heal your gut. And that's absolutely, I think, the foundation of functional medicine. Or you're not taking the right stuff. People haven't run the right tests to know that you're taking the right nutrients that you're either deficient in, or you're taking the right nutrients to detox what you have too much of. So one of two things we find is usually what brings the body back into homeostasis, which increases your energy and allows you to live better and more functional and more vital and feeling more alive. We either have too little of something or too much. So what we do in functional medicine is we add what you're lacking and take away what you have excess of and let the body balance itself. It's that simple, but that complicated. You have to work with a practitioner that knows the right tests to run, to know how to test these things, and that essentially is the definition of functional medicine, getting your body to function at its most optimal. So again, the 3 questions I've got about will functional medicine work for me, will the energy recovery system work for me, have been, I've got bad genes, I've got the MTHFR genetic defect, I'm on a thyroid medication. Of course, if you're on a thyroid medication, you're still fatigued, something else is wrong. I'm taking an antidepressant, I'm taking an anti-anxiety medication. Absolutely, we can work with those. I absolutely know the herbal interactions, and I'm very cautious when you're on something like that. And the goal for a lot of my patients is to get off those, right? We want your body functioning on its own. And then lastly, yes, you're already taking a bunch of supplements. If you're taking a bunch of supplements and you're still tired, absolutely you want to work with a functional medicine practitioner on your fatigue levels, because something's wrong. Something's either you're not absorbing or you're on the wrong stuff. So thank you guys. Happy Friday. Again, if you would like to ask me specific questions, this is an invite to the 3 p.m. Facebook Live Q&A inside the Energy Recovery group. So if you haven't joined the group, I'm going to start doing the Facebook Lives in the group. And happy weekend. For many of you, this is a weekend before school starts. Next week, we can start taking care of ourselves again as mothers and women when the kids go back to school. And if you want to have a discussion with me, you can book a call on our website for the energy-recovery-system.com. Dr. Tenesha Wards, I'm your fixing fatigue specialist.